If you're having your varicose veins treated and you're wondering, could you develop a deep vein thrombosis or clot in your legs, then I've got you covered on this video. Now, if you're having the traditional surgery, also known as stripping, the risk can be anywhere between 0.4% to 5.4% in terms of developing a clot. Now, if you're having radiofrequency ablation, the risk is anywhere between 0% up to 16%. And again, there's a lot of risk, there's a lot of different factors, including operator dependence in terms of when it's higher and when it's lower. And the same goes with endovenous laser ablations, which can be anywhere between 0 to up to 7.7%. Now, if you look at all three, it probably looks like surgery is the safest choice in terms of not developing a DVT, but there are a lot of factors here that often get missed, and one of them is that when you're actually having surgery, there's often a lot of prevention on board in terms of medication given to you to avoid you developing a clot in the first place. And also, in the surgical cases, if you do not have symptoms, a lot of patients aren't checked to make sure that they don't have a clot. So you may still have a clot but may not have symptoms, and this usually goes or passes by without anyone actually knowing. In the other two cases with radiofrequency and endovenous laser ablations, oftentimes patients are checked straight after treatment, either a week later or even a month later, and therefore this avoids the risk of actually having a clot and maybe picks up a lot more clots that are actually asymptomatic. But by and large, with the minimally invasive treatments, the risk of developing a DVT is very, 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 very low.